Alright, I'm live on TikTok. And
Perfect.
yep, everyone is live.
Yes,
Perfect.
hello everyone. Good morning. This is Dr. Shaher Khan from Bloomfield Hills, Michigan. I am a board certified plastic surgeon, and we're going to go ahead and start a new series of Q&A, question answer sessions. Any information that I find new developments, i.e., directly from the patients, so that we can talk about, and this is again all about informed consent, which basically means that you understand, for those many ladies who are interested in getting implants, as to what is what are the risks versus benefits of getting the breast implants and what to expect, and for those many ladies who have implants, so that they understand what and how they are, basically what symptoms they're experiencing, if this is from the breast implant illness or related. So as you will see, there is a lot of information we have from the FDA. We have a lot of information from the history as well. We also have a lot of information from the manufacturers themselves in regards to the warnings that they have posted. And then most importantly, you kind of combine what the FDA and the manufacturers have said, and listen to the patients directly. You will see and hear clearly as to what and how the breast implants, are ultimately affecting the patients. Again, this is not my opinion. This is again highlighting what is the obvious, what has been brought forth, and what we already know from history. So I will start off by saying that we know from 1992, the silicone breast implants were banned because of the silicone toxicity and the hurt they were causing because of the detrimental effects of the silicone implants within the patients. And then in 2007, the implants were reintroduced into the market. And this is when they were determined to be the gummy bear. They were made to be the gummy bear, safer, better implants, which would not rupture. And as you will see, if you follow my Facebook lives or YouTube lives, and if you go to my channels, you will see these implants, as very well mentioned by the FDA, are not lifetime devices. And again, this is echoed on the Mentor and Allergan and what used to be Sientra. They basically have said the same thing, that breast implants are not lifetime devices, number one. And number two, they also mentioned that the longer patients have them, the higher the chances are that they're going to have complications, some of which will require more surgery. The implants certainly do rupture as well. They have problems with malposition. Sometimes you can have capsular contracture in approximately 8, 10, 13% of the patients, depending on the studies that you will see, and the different type of implants. You can get infection, you can get acute and chronic pain, you can have altered sensation to the nipple, you can have for those young moms, they are not able to nurse as a result of the implants, a small fraction, if you will. Some patients have difficulty because of a contracture or pain, or simply the sheer large volume of the implant. They're not able to get a good self-monthly breast exam, or they do not want to get mammograms. And now these same ladies, a small subset, are not getting effective screening. And so as you will see, and on average, they last 10 to 15 years, some sooner that will need to be replaced, and some later. If you go to the Mentor advertisement itself and the Mentor warning, you will see they will mention those ladies that have silicone implants. They should get a MRI at year 3, and then every 2 years they're onward to look for what is a silent rupture, which basically means that the patient has a ruptured implant and she would not know that she has had a rupture till the surgery is done, or till she get at least an MRI to show it was ruptured. You do not want to wait for the rupture, because as you can imagine, there will be that silicone toxicity in the periphery. Now, many of the study or the warnings will mention that they do not know what the consequences of a ruptured implant are. And as you can see, they're raising awareness and getting the patients to do an MRI. But at the same time, the silicone toxicity, we know the silicone in some select patients will leach into the lymph nodes, will go into the periphery. You can get silicone granulomas, you can get silicone mastitis. and you can get inflammation around the capsule. And so this is where, and again, nothing that I have said is exaggerated. Nothing that I have said is my opinion. This is again the FDA slash the manufacturers, and most importantly, the many patients who are now benefiting from the explant. And as you will see, the whole goal of the surgery is to basically remove the entire implant plus that capsule plus all of that inflamed tissue around where this gel bleed, where there is silicone that leaches out of the intact saline implants, because the silicone shell of that saline implant will impart silicone particles. And even intact implants, silicone implants, and ruptured silicone implants for sure will impart more of these silicone particles that will embed within the periphery, within the capsule. So it is important to remove all of that capsular tissue along with that inflamed tissue. And once it's removed, it has to be tested for breast cancer, the BIALCL, which is very rare of rare. And to date, only 1,233 or so cases have been reported in the entire world, but a number that is certainly very much underreported because not everyone is removing the capsules. And even if they are removing the capsules, they're not getting it sent to pathology. And even when they do send it to pathology, they're not doing the CD30 analysis. And so once the entire capsule is removed, it is tested for any pathology. Cultures are done for bacteria and fungus. And let's say if your surgery is done today, you will have the peace of mind that the entire capsule is removed along with that inflamed tissue, and that entire implant is removed if it's ruptured in a contained fashion such that none of the silicone spills into the chest. Every week and every day I talk to many ladies who have had history of rupture and silicone that spill into the chest, and that is a major catastrophe to manage because the silica embeds within the soft tissues around, and you can imagine it is relatively caustic. One can see, if you look at what the chemical composition of the implants are, and you can certainly Google this, you will see it's made up of these many heavy metals, platinum, and all these other metals which ultimately are considered foreign. And we know the improvements in the many patients who have explanted, because that's our defined quote end result and goal. The many patients who have benefited from the explant where they don't have that silicone toxicity, and you see the improvement right in their faces before and after. And these patients certainly not only improve in their physical appearance because of the inflammation, but in their brain fog or the fatigue, which is the most common symptom of breast implant illness, along with, and again, in some patients, the migraine headaches, palpitations, neck and back pain, the rashes, hair loss, weight gain in majority of the patients, and some patients anorexia, for example, they have aversion to eating, tingling numbness in the arms and legs, along with plantar fasciitis, endocrine issues, autoimmune issues, amongst the many others. And so going back to the point, we have the many patients that accept the fact that they have certainly improved clinically, physiologically, and even mentally. The many psychological problems of implants, such as anxiety, panic attacks, mood swings, emotional instability, in some patients, suicidal ideations. And we know this also from the pathology, where the capsules, once sent to the pathologist, they look at giant cell reaction, histocytic reaction, and also the chronic inflammation that is noted in, along with, in some select patients, you will see silica embedded within the capsular tissue around the implant. So it is important to remove all of that capsule. So very briefly, on this very first of a series of weekly TikTok, Facebook, YouTube Live, and Instagram Live, I want to be able to answer your questions. As you can see, just this, in the last few 10-15 minutes, we have talked about the detrimental effects of the implants, and this is very clearly written in the manufacturer's guidelines. What are the risks of the implants? Number two, we have heard right now from me directly the benefits that the patients themselves are bringing forth in regards to the benefit, the improvement in their health. And we have the pathology that attests to the same. And we have seen, as you heard, the FDA warnings, the manufacturer warnings, and the patient's highlights. as to their improvement and in their recovery. Now, as you will see, breast implant illness 10 years ago was an unheard of term. And now you have so many websites devoted primarily to the care and attention of these many patients who are seeking help and relief from the many signs and symptoms, not only of breast implant illness. Remember, every person will not get breast implant illness, but some patients live. Last week, for example, I took care of a patient, and lo and behold, to my surprise and to her surprise, the right side was a ruptured implant, and we did not know this going into the case. So there are many patients who have had implants past the 10, 15 years, and they might truly be with what is a ruptured implant. So in these patients, as mentioned, the study of choice, if one needs to find out, is to get an MRI without contrast. So there is no radiation, it's magnetic resonance imaging and no contrast. And this is the best study to date that will tell the patient if she has ruptured implants or not. And then the one needs to also be aware that they need to do effective breast cancer screening. So you want to be able to get the mammograms and or the ultrasound as your breast center or your primary care physician is going to direct. And you want to be able to also be on the lookout for any of these sign symptoms, because in a patient that takes no medications and they have these many symptoms that mimic lupus, Lyme disease, rheumatoid arthritis, or they have this fatigue, joint pain, all these problems that I mentioned that affect almost every organ system of the body, some less, some more. For some, it might be no symptoms. These are patients that need to be aware that they once you have an implant, they need to be monitored very closely by a board certified plastic surgeon, and they need to basically anticipate and be able to, if they're living with a grade 4 contracture, they need to be aware that it is not normal and healthy to be living with pain or a contracture, and that they need to seek attention, and they need to get this addressed definitively. So if you follow my YouTube channel and Facebook primarily, and even Instagram and TikTok, you will see a lot of questions that I've answered. Initially, as you will see, how to choose your surgeon, what questions to ask your surgeon, so that you have that informed consent. What's interesting is, if you talk to 10 different plastic surgeons, without a doubt, you're going to get 10 different answers as to how they manage and how they take care of the explant. As you will see, vast majority of the surgeons nowadays, you will see their websites, they have the term breast implant illness very well written on their webpage. And this is where a lot of patients are now wanting to get an explant. No two surgeons are the same when it comes to an explantation. And every surgeon has their own defined way and technique, as you will see. More of them, if you ask me, 9 out of 10, if not all 10, are going to be more interested in doing the lift and the aesthetics and not focused into removing the whole capsule. And this is where, in vast majority of the patients, when they have implants, it's below the muscle, directly on top of the rib, you will see that removal of that capsule is not an easy task. And in my technique, in my practice, I remove not only the implant capsule, but that fascia of the intercostal muscle, that's the fascia directly on top of the muscle in between the ribs, plus the perichondrium and the periosteum, that's the layer directly on top of the rib, along with the fascia of the pectoralis minor, and also the fascia of the serratus anterior muscle, such that this ensures complete removal of that capsular burden so that there is no inflammatory burden left behind. And this is what it entails. So cauterizing that capsule, or burning it off, or leaving part of it behind is not the answer. That is incomplete surgery. You do not want to recover from your surgery partially. Just a few hours from now, I'm going to go ahead and do a Facebook Live with a patient of mine from Arizona. She already had her explant, and now she has what are residual capsules, and she seeks consultation with me so that I can remove those residual capsules definitively. And you will hear from her directly and you will see why she came to me, what benefit she has had almost a year out, and why it was important for her to remove the residual capsules. Just within the last month, I took care of a lady with calf implants, implants that were placed at the medial gastrocnemius muscle and the lower leg, and she reported herself subjectively, young lady in her late 30s, the many benefits that she has had from a calf implant that was removed. Just this morning, I talked to a lady who had buttock implants, and these were done in Ecuador, and these were the Motiva, what are the textured implants, and she has what is an active infection in her left buttock because of the fever and the pain she's having, and there's certainly an urgency on her end to put out that fire, take care of whatever that infection slash problem she's dealing with, and ultimately she will have the same problem that that lady with the calf implant did and the breast implants, because it's essentially the root cause of the problem is that silicone that leaches from the implant into the periphery, what is the gel bleed, which is very well echoed and reaffirmed by Dr. Henry Dijkman from the Netherlands, who has done a lot of studies, and that shows that this gel bleed starts occurring from day one. And this is where you will hear directly from her and see the benefits of the explant done right, with the residual capsules being removed, and what and how she got the relief that she very much needed, even though she had had an explant before. I'll end by saying there are many patients who have gone to other surgeons, and the whole emphasis was more on the aesthetics than on the explant done right. In my hands and my technique using the con procedure, you will see it takes me 4 hours on average to doing an explant on an average size implant, for example 325 cc's below the muscle on a lady who is average. So those implants that are 800 ruptured, or has had multiple implants before, one above or one below, those surgeries certainly indeed can be longer. And in my practice, the average explant takes at least, I would say, 4 hours, 2/3 of the time where I go over. And this is the etiquette and finesse that I have, and I'll end with my technique, the con procedure, where number one, I don't place drains. As you will see, the drains are not required. I have done so many patients, literally thousands, where they have not had the need for drains. They do not come back to me for drain placement or seek out any other surgeons. And clearly, I've presented at an international conference where the drain requirement is certainly not there. Number two, I don't do the unnecessary lift between the excess skin that I remove at the bottom and the internal sutures that I put that lift the breast tissue up, and between the implant being gone that's gravitating the breast tissue down, between the inflammation subsiding and the breast tissue and the skin recoiling, and between the fluffing effect and between the 5-10% muscle mass that the patients add to their chest. Aesthetically, they improve relatively very well without the need for that exaggerated unnecessary lift in well over 80% of the time. And you do not want to complicate a surgery by doing too much surgery on a day where the whole emphasis and goal is to doing the best explant and the perfect explant with no capsular tissue remaining behind. Number three, I send the capsules off to pathology 100% of the time, so that the CD30 analysis is done, which I mandate my pathologist to do, along with ruling out BISCC, which is very rare of rare, but still needs to be ruled out. Breast cancer, any abnormal pathology. Number four, I take cultures for aerobic, anaerobic, and fungal. Number five, I take high definition pictures and videos of the chest wall showing complete removal of the implant and the capsule, not only on the chest wall, which is the most important video, but me cutting open of the capsule directly on top of the table. Number six, the twilight anesthesia, where I do the propofol, fentanyl, Versed, and without the need, what is the general anesthesia, which causes the patients to be paralyzed, and the breathing tube, essentially where the ventilator is breathing for the patient. So I don't use that general anesthesia. I utilize what is the twilight deep sedation, where to date not a single patient has had any recollection of the surgery, and very effective, safe anesthesia, along with what is a local nerve block. And number seven, I basically return the implants to the patient, especially in those many patients that have saline implants. You do not want to rupture. We hear of the many surgeons that want to do the surgery under local, or they rupture the saline implant, and then a couple of weeks later they basically attend to the patient. You do not want to be doing this. And last but not least, what I offer to one patient, I offer to all. So I don't compromise because the patient has many comorbidities. The same surgery I do on a 25-year-old, I do on the 75-year-old, because she deserves the same level of care and attention regardless of her comorbidities. Now, if a patient is ASA 3 classification or higher, or if they have multiple medical issues, then I go to the hospital where I can offer the same surgery in a setting where this lady with COPD or underlying health conditions, history of heart disease, for example, she will be better taken care of. And every patient deserves the same class of care, regardless of the age or comorbidities. And again, this is a very well tolerated outpatient surgery. 2/3 of my patients come to me from out of town, and I'm blessed to have a very good practice where I can manage the patients. And once they leave and get discharged day 4, day 5, I'm able to easily follow them from the comfort of their own home, and I'm able to have a very good post-operative follow-up course. So hopefully you found this informative. There's a lot to discuss about. This is like a very brief overview. Remember, at the end of the day, it is the integrity of the surgeon and it is the professionalism of the surgeon where they do not do any harm. They do no harm. The whole goal and emphasis is to basically remove the whole capsule, implant, and all inflamed tissue. And that, let's say, if the surgery was done today, the patient has the peace of mind that the surgeon removed the whole capsule and it was tested and the inflamed tissue around, and you have the peace of mind that you're going to only have a better recovery, and time will be witness to that. I never tell or promise my patients in what capacity and how they're going to improve. As you will see, that if you listen just to the many patients, you will see that they echo two things. Number one, they wish they had never gotten the implants, and they wished they had gotten them removed sooner before they dealt with the many problems that ultimately started affecting them. Right now, I want to, and the purpose of this is the patients are the boss. The patients are the ones who are going to determine. My goal here is to basically, as a plastic surgeon, be able to provide concrete, hard evidence so that you know what you signed up for, what you're signing up for, and that you understand in my practice how I do it, why I do it. And this is why when the many patients that come to me, they're actually excited about their surgery and they know that their good health only awaits them. So having said this, I'll go ahead and conclude my very first session. We will go ahead and do it at a very systematic time such that every week I'm able to answer any of the questions. Please jot your questions down. Please ask questions. You want to talk to the surgeon directly who's going to do the surgery, not the PA, not the nurse practitioner, not the medical assistant, or not the liaison. You want to be able to converse directly to the surgeon. Every patient is a challenge, no matter what surgery is done, especially the surgery. This is where, as you come to me, it is important so that I can say that when you come, we have done our level best to make sure you don't have a low thyroid or you're anemic or any other problems that may account for the fatigue or the brain fog, or the other problems that may mimic or complicate the recovery. This is Dr. Khan, Executive Plastic Surgery.